The fibula is the lateral and smaller bone of the leg. It is very thin compared to the tibia. It is homologous with the ulna of the upper limb. The fibula comprises an upper end or head with a circular articular facet and a small styloid process, a lower end with a prominent lateral malleolus and a thin shaft between the two ends. If we look closely at the upper end of the head of the fibula, the upper end is slightly expanded in all directions. The apex of the head, or the styloid process, projects upwards from its posterolateral aspect. The constriction immediately below the head is known as the neck of the fibula. The superior surface bears a circular articular facet that articulates with the lateral condyle of the tibia, forming the proximal tibio-fibular joint. If you look at the shaft of the fibula, the shaft shows considerable variation in its form because it is molded by the muscles attached to it. It has three borders: anterior, posterior, and interosseous borders, and three surfaces: medial, lateral, and posterior surfaces. The anterior border begins just below the anterior aspect of the head. It is continuous with the lateral surface of the lateral malleolus. The posterior border is rounded. Its upper end lies in line with the styloid process. Below, the border is continuous with the medial margin of the groove on the back of the lateral malleolus. The interosseous or medial border lies just medial to the anterior border, but on a more posterior plane. It terminates below at the upper end of a roughened area above the talar facet of the lateral malleolus. In its upper two-thirds, the interosseous border lies very close to the anterior border and may be indistinguishable from it. Visualizing these borders through a transverse section through shaft of middle 2/4 of fibula is much easier, and the surfaces of the bones are also easy to see. As for the surfaces, the medial surface lies between the anterior and interosseous borders. In its upper two-thirds, it is very narrow, measuring 1 mm or less. The lateral surface lies between the anterior and posterior borders. It is twisted backward in its lower part. The posterior surface is the largest of the three surfaces. It lies between the interosseous and posterior borders. In its upper two-thirds, it is divided into two parts by a vertical ridge called the medial crest. As for the lower end of the fibula, the lower end is prolonged to form lateral malleolus. The lateral malleolus is subcutaneous and can be felt and seen at the lateral aspect of the foot. Its medial surface articulates with the talus. If we compare it with the lower end of the tibia that forms the medial malleolus, then the tip of the lateral malleolus is 0.5 centimeters lower than that of the medial malleolus. It has the following four surfaces. The anterior surface is rough and rounded. The posterior surface is marked by a groove. The lateral surface is subcutaneous. The medial surface bears a triangular articular facet for the talus anteriorly and the malleolar fossa posteriorly. Now that you are aware of the basic features of the fibula, it will be easier for you to determine the side and anatomical position of the bone. The upper end or head is slightly expanded in all directions. The lower end or lateral malleolus is expanded anteroposteriorly and is flattened from side to side. We also have the facet present on the medial side of the lower end and a deep or malleolar fossa posteriorly. That help determines the anatomical position of the bone. Lastly, let's go through the attachments and relations of the fibular bone. To boost your memorization, let's go through the muscles that originate from the fibular bone surfaces one by one, starting with the medial surface of shaft. As shown here, the extensor digitorum longus originates from the whole of the upper 1/4 and from the anterior half of the middle 2/4. while a muscle called the extensor hallucis longus originates from the posterior half of its middle 2/4. Peroneus tertius also attach at medial surface. A mnemonic to remember these muscles goes as, "My son eats eggs proudly," where you can associate the words "my son" with the medial surface of shaft. And first E is for extensor digitorum longus, second E is for extensor hallucis longus, while P is for peroneus tertius. Moving on to the lateral surface of the shaft, it gives origin to peroneus longus from its upper 1/3 and posterior half of the middle 1/3, and the peroneus brevis from the anterior half of its middle 1/3 and the whole of lower 1/3. The common peroneal nerve terminates in relation to the neck of fibula. We talked about how the posterior surface of fibula, its largest surface and divided by the medial crest. The part of the posterior surface between the medial crest and the posterior border gives origin to soleus and flexor hallucis longus, while the part of the posterior surface between the medial crest and the interosseous border, that is, the grooved part, gives origin to the tibialis posterior. So far, we have talked about the muscles that originate from the fibula, not the ones that are inserted here. Only one muscle has an insertion site at the head of the fibula, that is the biceps femoris. The head of the fibula receives the insertion of the biceps femoris on the anterolateral slope of the apex. This insertion is C-shaped. The fibular collateral ligament of the knee joint is attached within the C-shaped area. Other than these muscles, the fibula also gives attachment to other muscular structures such as interosseous membrane at the interosseous or medial border of the fibula, superior extensor retinaculum and posterior intermuscular septum, and the ligament attachments at the lower end of the fibula are shown here. The interosseous tibiofibular ligament, the anterior tibiofibular ligament, the posterior tibiofibular ligament, inferior transverse tibiofibular ligament, anterior and posterior talofibular ligaments, and calcaneofibular ligament. They all arise from different parts of the tibiofibular joint, which is why they are named as such. We will talk about these structures in detail in an upcoming video on the regional anatomy. For now, to help you remember the muscles that originate from the fibula, we have another mnemonic. The 8 muscles that are originating from fibula are tibialis posterior, flexor hallucis longus, extensor digitorum longus, peroneus longus, peroneus tertius, peroneus brevis, extensor hallucis longus, soleus. The mnemonic, the fox eats peas, potatoes and peach, except spinach, can help you remember the names of these muscles. You can pause and commit the names of these muscles to your memory with the help of this mnemonic. That is all about the second bone of the leg, called the fibula.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.